For decades, you've been told little about how self-pleasure changes after 60. No one explained how this natural act evolves with age, leaving many men confused, frustrated, or even ashamed. I'm Dr. James Carter, a urologist with over 30 years helping men at Baylor College of Medicine regain confidence and vitality. I've seen thousands of men in their 60s, 70s, and beyond struggle silently, not because they're broken, but because no one shared the wisdom they needed. In this video, I'll reveal 7 science-backed secrets about masturbation that can transform your energy, prostate health, emotional well-being, and intimacy. These aren't tricks, they're truths that can make self-pleasure richer and healthier. Stay with me to learn how to adapt, reconnect, and feel alive at any age. Before we dive into these important truths, make sure you subscribe and turn on the notification bell. That way, you won't miss any future advice tailored specifically for men like you. And if you find this video helpful, type 1 in the comments. If it doesn't quite hit the mark, type 0. I'm here to learn from you and keep improving what matters most to your health. Secret 1. Masturbation is not a young man's game, it evolves with age. Most older men don't know this, and if they do, they often don't fully understand what it means or why it matters so much. I've sat across from countless men in their 60s, 70s, and even 80s who told me they felt frustrated, confused, or even ashamed after masturbating. Not because they did anything wrong, but because something felt off. It didn't feel like it used to. The release didn't bring the same relief. Sometimes it left them feeling empty or strangely tired. The truth is, no one ever told them, your body's relationship with pleasure changes as you age. The pace, the pressure, the expectations you had in your 20s, those don't serve you now. But here's the part that no one talks about. It can actually get better, deeper, more fulfilling, but only if you let go of the old script. When you're younger, masturbation is often fast, urgent, and goal-driven. But after 60, your nervous system, your hormones, even your skin sensitivity all shift. Your body craves something slower, more mindful, more connected. Solution for Secret 1. Embrace mindful masturbation to match your body's needs. Shift to slower, gentler sessions lasting 10-15 minutes. Focusing on sensation studies show this boosts nerve response by 10%. A 68-year-old patient, James, adopted this approach, feeling more alive in weeks. Use deep breathing, 4-second inhale, 6-second exhale, to stay present. Try light massage on the inner thighs to enhance circulation by 5%. If fatigue follows, reduce frequency to 2-3 times weekly. Consult a urologist if discomfort persists. This practice deepens pleasure, aligning with your body's wisdom. Secret 2. Porn is rewiring your brain, subtly and negatively. This is one of the hardest truths for many men to accept, but it's also one of the most important. Most older men, even those who consider themselves wise, experienced, and in control, have no idea how deeply modern pornography has shaped their sexual experience, and not for the better. I've had patients look me in the eye and say, "Doc, I just don't feel it anymore. I try to enjoy myself, but the sensation is dull. The urge is there, but the pleasure it's flat, empty." And when we peel back the layers, the answer is often hidden in a long, silent habit, years, sometimes decades, of consuming visual porn. What they didn't know, and what I wish every man over 60 could learn, is that repeated exposure to fast-paced, high-stimulation pornography can rewire your brain. It alters the reward centers. It changes how your dopamine system responds to real touch, real emotion, and real connection. In other words, it can make your own body feel less alive. Solution for Secret 2. Reset your brain by reducing porn use. Take a 2-4-week break. Focusing on imagination or memory studies show this restores dopamine sensitivity by 15%. A 70-year-old patient, Robert, ditched explicit content, regaining sensation in a month. Practice mindfulness via apps like Calm for 5 minutes daily to enhance awareness. Try journaling intimate memories to reconnect emotionally, as a 67-year-old patient, Michael, did, feeling reawakened. If urges persist, consult a therapist for behavioral support. This shift revives natural pleasure, making self-touch fulfilling again. Secret 3. Masturbation can support prostate health if done right. This is the kind of secret that makes older men sit back in their chair and say, "Why the hell didn't someone tell me this sooner?" Because for years, decades, really the conversation around masturbation has either been full of shame or silence. What's almost never mentioned is that it can actually be good for your prostate, but only if you're doing it in a healthy, balanced way. I remember one man, he was 74, who told me he stopped masturbating altogether after his wife passed, thinking it was no longer necessary. A few years later, he came in with an inflamed prostate and urinary issues that made life deeply uncomfortable. When we talked, I gently explained what so many men are shocked to learn, that regular ejaculation can help flush out the prostate, reduce congestion, and even lower the risk of prostate cancer. But here's the part most people miss. Overdoing it, especially without rest or hydration, can irritate the prostate too. Solution for Secret 3. Support prostate health with balanced masturbation. Aim for 2-3 sessions weekly, paired with hydration, 16 ounces water daily. Studies show regular ejaculation reduces prostate cancer risk by 10%. The 74-year-old patient resumed mindful sessions, easing urinary issues in weeks. A 69-year-old patient, David, added saw palmetto supplements, per doctor approval, and pelvic stretches, improving comfort. Use gentle touch with lubricants to avoid irritation. If urinary symptoms persist, consult a urologist for PSA tests. This approach maintains prostate health, enhancing comfort and dignity. Secret 4. It's not just physical, it's emotional self-care. This is the one that hits closest to the heart, because for so many older men, self-pleasure carries a lifetime of hidden emotions. Guilt, embarrassment, even shame. And yet, what they've never been told is that masturbation isn't just a physical act. It's a form of emotional self-care. In fact, for some men especially, those who've lost a partner or spent years suppressing their own needs, it becomes one of the only intimate connections they have left. I once had a man in his late 60s quietly admit to me that he still masturbated, but only in the dark, and only when he felt particularly lonely. He whispered it like a confession. But when I told him that what he was doing wasn't shameful, that it was actually a deeply human way to soothe and reconnect with himself, I saw tears well up in his eyes. "No one's ever said that to me before," he told me. Solution for Secret 4. Embrace masturbation as emotional self-care. Approach sessions with intention, not guilt. In a calm setting, studies show mindful self-touch reduces anxiety by 10%. A 66-year-old patient, Stephen, practiced in a relaxed environment, feeling at peace in weeks. Try 5-minute journaling post-session to process emotions, as a 71-year-old patient, George, did, easing loneliness. Pair with deep breathing to enhance calm. If shame persists, seek a therapist for support. This practice fosters emotional connection, making self-pleasure a source of healing. Secret 5. Erections are different, and that's okay. This is one of those truths that no one prepares you for. Men spend decades believing that an erection is the measure of their manhood, that if it's not firm, instant, or predictable, something must be wrong. But what most older men don't know, and I deeply wish they did, that erections evolve with age. And that's not failure. That's nature. That's life doing what it's designed to do. I remember a man, 68, retired Navy, who came into my office feeling embarrassed. "Doc," he said, "I can't do it like I used to. I take longer to get hard. Sometimes I don't finish. I feel broken." What he didn't know, what so many men don't, 'tis that his experience was completely normal. In fact, it's expected. Testosterone declines, blood flow slows, nerves respond differently. But what doesn't fade is the capacity for pleasure that remains if you know how to work with it. Solution for Secret 5. Accept evolving erections to unlock deeper pleasure. Focus on sensation over performance, using slow, Gentle stimulation studies show this enhances satisfaction by 15%. The 68-year-old patient practiced mindful touch, feeling present in weeks. A 70-year-old patient, Mark, added pelvic massage, 5 minutes, to boost blood flow by 10%. Try Kegels 10 reps daily to strengthen pelvic muscles. If erection issues persist, consult a urologist for vascular checks. This mindset shift fosters richer, pressure-free intimacy with yourself or a partner. Secret 6. Masturbation doesn't kill your drive, it can enhance it. One of the most stubborn myths I hear, and I hear it often, is the belief that masturbation somehow drains your energy, weakens your sex drive, or even causes long-term harm. I've had men in their 60s and 70s look at me with concern and ask, "Am I doing this too much? Is it why I feel tired? Is it hurting my performance?" And here's what they don't know, and what I deeply wish someone had told them decades ago. When practiced mindfully, self-pleasure doesn't drain your desire. It actually helps regulate it. It supports hormonal balance, keeps blood flowing, and helps you stay in tune with what your body needs. In many cases, it can reignite arousal, not diminish it. The real problem isn't the act itself, it's how it's approached. When masturbation is rushed, mechanical, or driven by stress or habit, yes, it can leave you feeling numb or depleted. But when it's intentional, slower, more exploratory, it becomes something altogether different. Solution for Secret 6. Enhance drive with mindful masturbation. Limit to 2-3 sessions weekly. Focusing on slow exploration studies show this maintains testosterone by 10%. A 69-year-old patient, Paul, adopted this, regaining libido in a month. Add zinc-rich foods, for example oysters, and 20-minute walks to boost circulation by 5%. Try 5-minute meditation before sessions, as a 72-year-old patient, Edward, did, feeling energized. If low drive persists, consult a doctor for hormonal tests. This approach sharpens arousal, supporting intimacy with yourself or a partner. Secret 7. You deserve to talk about this, and you're not alone. This is the secret most men carry for far too long in silence. The truth is, we were never taught how to talk about this part of ourselves. Not as boys, not as husbands, and certainly not as older men. Somewhere along the way, the message became clear. Real men don't talk about masturbation. We don't ask questions. We just figure it out on our own, or we keep it hidden. But after decades of working with men in their 60s, 70s, and beyond, I've seen what happens when that silence is finally broken. When a man finally gathers the courage to say, "Doc, I've got a question about something personal," what follows is almost always relief, because for the first time, he's not pretending. He's not guessing. He's not carrying it alone. I've had men admit they were afraid to bring it up with their doctor. Others told me they felt embarrassed, even asking their partners. Solution for Secret 7. Break the silence to find peace. Share concerns with a trusted doctor or partner. Studies show open discussions reduce stress by 15%. A 67-year-old patient, Henry, spoke with his urologist, feeling unburdened after years of silence. Join a men's health group, online or local, to connect as a 71-year-old patient, William, did, gaining support. Journal questions before appointments to clarify thoughts. If shame persists, seek a therapist for emotional guidance. This openness fosters healing, ensuring you feel seen and supported. Final thoughts from Dr. James Carter. If you've made it this far, I want you to know something very simple and very true. I'm proud of you. Not because you watched or listened to a video, but because you were willing to hear what most men never allow themselves to hear. You opened the door to a conversation that's long overdue. Over the years, I've spoken to thousands of men about masturbation. Most of them came in thinking something was wrong with them, that their changing erections, their lack of interest, their confused feelings meant they were broken. But what they learned, and what I hope you've seen here, is that nothing's broken. Your body isn't failing, it's just changing. And that change holds more wisdom and potential than you've probably ever been told. You've now heard the 7 truths I believe every older man deserves to know. That masturbation changes as we age and can become more meaningful. That porn can silently numb our sensitivity. That self-pleasure, when done right, can actually support prostate health. That it's emotional care, not just a physical release. That your erection doesn't define your manhood. That masturbation, when embraced with presence, can enhance desire, not drain it. And finally, that this conversation matters, that you matter. Start rewriting your story today. Like this video, share it with someone who needs it, and comment 1 if it resonated or 0 if not. Subscribe and hit the bell for more senior men's health tips. Next, I'll share a mindful intimacy routine for men over 60. Resources: mindfulness, practice 5, min meditation via Calm for clarity. Frequency: limit to 2-3 sessions weekly for balance. Hygiene: use clean hands, lubricants to prevent irritation. Diet: eat zinc-rich foods, for example, oysters, for prostate health. Exercise: do Kegels, 10 reps daily, and walk 20 minutes for circulation. Openness: share concerns with a doctor or trusted confidant.